Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I was working on a patient.
Okay.
And I was showing her demonstrating a shoulder extension on the reformer, Pilates reformer.
Okay.
And I felt it kind of slip pop, whatever you want to call it.
Mm-hmm.
And after that, I had pain. Mm-hmm. Just barely, like maybe a 3 out of a 10. Mm-hmm. And then we finished her treatment, and the next day I noticed I didn't quite have the range of motion, and I had more pain doing patients.
Okay, so what you do, your career, your job?
Physical therapy.
Okay.
So when I'm manually working on people, I can feel it like right in here.
Okay. How long has it been going on?
About a month and a half.
A month and a half. And how much pain do you feel there at worst from 0 to 10? 10 is emergency room.
Usually about 5 or 6. As long as I don't take it to like the end range, and then it goes up.
And what aggravates your symptoms? What motion?
Working on people.
Like just pushing, pulling, or something?
Pulling. I've noticed a decrease as far as this like long arm flexion. Even bicep curls, I can't do what I used to do. I've been doing rotator cuff exercises and some scapular stabilization exercises, and can normally do them pretty good. I can feel myself substituting with those though.
Okay. How you describe your pain? Is it sharp, dull, aching? Where do you feel it exactly?
It's kind of sharp at the end range when I get there, and when I'm working on people pushing, it's just kind of more dull. But
is it more anterior, posterior? Where exactly the pain, or it's vary?
It's all of them. So I definitely feel it anterior. Sometimes I feel it inferior.
Oh, okay. All right. So let me see your range of motion now, and tell me how much pain at the end range.
Up here, and that's probably like maybe a 3 right now.
Okay. All right.
If I repeat it, do repetitions, and we'll get more.
Okay. Let's do abduction.
And that's gonna be about it.
How much?
That one really doesn't hurt that bad. It just kind of stops.
Okay. Let's do external rotation. I will have you stand up. Actually, we'll see a range of motion, left and right. Turn.
You want this one? This is my normal one.
Yeah. You're definitely going. Do both at the same time and see. We'll see the restriction. Yeah, that's very limited, and that's for a month. Yeah.
Yeah.
Flexion 155. Okay, let's do the abduction. It's gonna be from the top. Oh, wow. Let's try.
It's easier standing up.
Yeah.
Yeah.
Is that abduction?
Yeah.
Sorry. Okay, so you can see it here.
It's just I can't raise the arm up.
It's like 95. Actually, it's 80. Look here. 85. That's 85. Right in here, 85.
But like if that was supported, I could do it. It's just like I can't hold it.
We're gonna use the same exact position to be accurate, you know, before and after, because you felt it jammed here.
Yeah.
Okay. So external rotation backward. So external rotation is okay. It's 70. It's not bad. 70 here. Okay. Internal rotation. Down this way. Okay. Turn rotation like 58. It's about 58. Okay. So
feel the difference between the scar tissue and just like an inflamed muscle.
Well, if it's inflamed, it's going to be very sensitive. I'm not going to work on it if it's inflamed. If it's a scar tissue, you can feel the fullness, you can feel that like a knot. If it's a fascia restrictions, you're going to feel band or rope or something like that. And the superficial fascia.
I'm just asking because I feel it with my thumbs at work, but I don't know how to feel it with that thing yet. I'm learning.
I palpate with my hands, and I use the instrument. With the other instrument, you can feel the scar tissue actually better than your hand.
Okay.
With the fascia,
Sweet.
With the fascia, you have to use, for the deep, you need to palpate with your hand. Yeah. feel the less fullness, the thickness of the knot is decreasing. That's what I'm looking for. Too much?
No.
Make sure it's not too much. I'm gonna give you a needle. Okay. Not really.
I would be up off this table.
Yeah, we don't give needle in physical therapy. Okay. Some they give dry needle.
Yeah, no, I don't.
Yeah.
I don't say to anybody for that.
The study's not really showing a lot coming out of dry needles. Yeah. Just taking a lot of hypes. Is that too much?
I don't know what too much is.
As long as it's not painful, it's okay. If you feel pressure, that's fine. It's normal to feel pressure, but if you feel pain,
that one's painful.
You gotta take it easy if it's painful.
That one spot, yep.
Have you injured your shoulder before that happened, or just...
I had surgery on this side.
What did you do?
I was working and we were doing a skateboarding championship. And I just, I think overworked. I was by myself and just working. And,
you feel the scar tissue here?
Oh, yeah.
That's what I feel with this instrument. I don't need to use my hand with this. Just use it on it and I can feel the bump. And you see it's...
that is so cool. I cannot wait to
jumping. Yeah. Yeah. You see that? And patient actually feel it. And you can see redness where you have more scar tissue and everything like normal color. Okay, let's do it again. So originally was how much? 85. Now we are 173. Good, 173, not bad. Okay, what about the...
And I can bring it back myself.
Yeah. And flexion, how much it was? 155. 155. Let's do the flexion. Okay, flexion is 175. So it's increased 20 degrees. Okay. The abduction was 85 and increased like almost double. Not good enough. Okay. So external rotation, how much?
70.
Okay. Are you trying to show off now? Sorry.
Yeah.
Yeah, it's 85, okay? Oh, sorry. It's 90. It was 70? 90? Okay. So, internal rotation, how much it was?
58.
58? You said 58, yeah?
Yep.
Oh, okay. That's a 75. Alright, so...
I feel it kind of right.
How much from 0 to 10?
Compared to what it was before, I don't know.
Okay.
I can kind of feel it kind of crunching.
Okay, let's turn around and we'll see. One is fine, okay? Let's do face the window and let's bring your arm back.
This one?
Yeah, both of them because that was restricted. Yeah. How's that? Look at that. Look at that. Look at that.
Little tight at the end range, but that is...
But you actually you're able to bring it back all the way. Yeah, let's turn around. How'd that feel?
It feels great.
Alright, what do you think about the ASTR treatment?
I think I'm coming back.
Alright, awesome. Thank you so much. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.